Welcome to the Dementia Caregivers podcast series. In this podcast, Lan Trinh with the Alzheimer's Association will cover the basics of dementia. First, what is dementia?
Well, dementia is not a specific disease. It's actually a term to describe a group of symptoms associated with a decline in memory and other thinking abilities.
How is dementia different from what happens during the typical aging process?
As we age, we make occasional mistakes. We forget words here and there. We may forget where we put our keys, where we put our glasses. But when we're talking about dementia, what's not typical is waking up and not knowing what days it is and continue to not know.
How does Alzheimer's disease differ from dementia?
It's an actual disease of the brain that causes problem with thinking, memory, and behavior. And Alzheimer's disease is not a typical part of aging. It's actually very progressive and is fatal.
What are the different types of dementia?
So Alzheimer's is the most common form of dementia. That accounts for 60 to 80% of the dementia cases. And the second most common form of dementia is what we call vascular dementia. And vascular dementia occurs when, after a stroke, part of the brain are not functioning normally, and it causes problem to movement, judgment, speech, communication, all the other part of the brain functions. So another type of dementia is frontotemporal, and that occurs in the frontotemporal lobe of the brain that causes shrinkage of the brain, and it causes the person to change their personality, change their mood, their movement, their walking, balancing ability. And there's Lewy body. Lewy body dementia occurs or impact or affect the person's ability to think, to plan, and to reason. Another symptom of Lewy body dementia is visual hallucination or rigidity.
What causes dementia and Alzheimer's disease?
Most experts believe that Alzheimer's disease is a result of multiple factors, including genetics, socioeconomic factors, the person's social environment and the physical environment, as well as other health conditions such as cardiovascular disease or diabetes. Those really increase their risk. But we know that dementia is caused by damage to brain cells. And when brain cells are unable to communicate with each other, problems with thinking, feelings, or behavior can occur.
What is the typical progression of Alzheimer's disease?
The course of the disease depends in part on age at diagnosis and whether or not that person have other health conditions.
What challenges do caregivers face when caring for someone with dementia?
In the early stage, someone with Alzheimer's disease can live very independently, and they can drive, they can go to work, they can still be part of a social life. For that stage, people who are caring for a person with Alzheimer's disease are there pretty much to support and to be a companion and to help plan for the future. The stages change in the middle by the damages that's done to the brain. It makes it difficult for the person with the disease to express thoughts or to perform daily routines. So the caregiver really have to step up and be able to understand that process. People in the late stage of Alzheimer's disease, they have difficulty swallowing and eating. They may need assistance with walking. They may need full-time help with personal care. All that personal care is now taken care of by the caregiver. And then at the late stage, communication is really just diminished.
What are some strategies for providing care for people living with dementia?
So, be kind to those with the disease, be very patient, avoid confrontation, reassure them a lot of times, and ask them, is this what you mean? And even if you don't understand what they mean.
What resources do you recommend to caregivers of people living with dementia?
Well, we have a lot of resources at the Alzheimer Association, and we provide program and resources to families and individuals affected by the disease. So we have free caregiver training. It's a 6-week training course, and we have community workshops that are available throughout the county of LA. We also have support groups. We have social workers at the office that can work with the family caregivers on a one-on-one basis to help them kind of adjust to their new roles. So we encourage caregivers to really take a step back, have a different outlook about caregiving, rather than trying to fix the problem, but just kind of go with the flow.
We hope this podcast gave you some insight into the basics of dementia and Alzheimer's disease. Additionally, if you have ideas for podcast topics, please email us at nursinghomes@hsag.com. Thank you, and stay tuned for upcoming podcasts about different topics that we hope will be relevant to you as a caregiver for someone living with dementia.